Well, welcome everyone, and thank you very much for joining us for the session, Attend Anywhere Learning for the Future. So just to give a few ground rules that will help with the next hour or so. So in order to avoid background noise, could we please ask you that you mute your microphone if you're not speaking? Obviously, do switch it on when you have a question, and for that, please, could you either raise your hand or note down in the chat. Now, you can choose to have your cameras off or on, whichever you feel most comfortable with. And also there may be a factor of when we turn our cameras off that it can improve connectivity if that is an issue. Now, I've just talked already about the hands up or the chat function. And also with regards to connectivity, it is worth coming off the VPN because that can really improve the stability of the connection as well. Now, finally, just to say the live session will be recorded to enable us to share with others who can't make it today. And so by attending this event, you're giving us permission to share the recording with staff and members of the public. So, and now I'll hand over to Deepak Swami, Lynn Bursko, and Grania Coakley, who will share with us about their experience and learning of Attend Anywhere.
Thank you, Gerke. Hello, everybody. I'm Dr. Deepak Swami. I'm the psychiatrist working in the SANS team at Michael Carlisle Center. I have a presentation to do about the Attend Anywhere, which is the video platform for patient consultation that we have been using during the COVID-19 situation. This is part of the quality improvement because it has kind of transformed the patient consultations, what we do in our trust. So just to give you a bit of background, with the advent of COVID-19, it was quite imperative to have a secure video platform in the trust. So this kind of rolled out in, I think there were plans about this in March itself, but I think it kind of rolled out in April. So the idea was to help to facilitate clinical assessments via video consultations with patients. So Zoom platform was initially considered, but it was considered a security risk and there were concerns raised about the privacy and confidentiality. So the Microsoft Teams was there, but it was approved to use within the teams internally in the trust. So what is Attend Anywhere? So Attend Anywhere is a secure web-based video platform that has been introduced in the trust. It is a cloud software approved by NHS England, and it can be used for patient video consultations. And also, if you choose to, you can use it internally for meetings within the teams as well. Privacy and confidentiality concerns are taken care of in patient consultations, and patients are asked, they have a kind of a disclaimer, a tick box to do that they are not supposed to be recording the consultations, and that is as a prerequisite for signing up to this. So when we initially started this exercise, initially all the clinicians who were wanting to do the patient consultations, they needed to get themselves registered on the Attend Anywhere. So it was basically around video conferencing, and the decision on the suitability of patients. Literally every patient could be seen through this video consultation. But also initially it was felt that it is a trust approved standard operating procedures need to be put into place for this. It works in Google Chrome or Apple Safari preferably, and tends not to work in Internet Explorer and Mozilla Firefox. And I don't know since then whether this has been rectified as well. So what happens initially, we get an email with asking us to create an account and with sign-in instructions. So there are some links where you need to go and register yourself. I'll show you some screenshots of how this is done. Probably I'll need to unshare and share it again because it's on a different platform. I don't know whether you can see this. Let me just unshare and share it again. Can you see this now? Can anybody confirm to me whether you can see this?
Yes, we can, Deepak.
Okay, thank you. So this is the email we get initially from any of your authorized managers who can register any of the team members, and you get this email from the Attend Anywhere to create an NHS England Attend Anywhere user account. It's quite easy. Basically, it's the trust email ID, and you create your own password. And then after you create your account, there is some sign-in instructions. And if you need any assistance, there is an email address where you can go and email them as well. So once you're registered, then you get the sign-in instructions, and this is the email and password you need to put in to sign in. So this is where you get in when you sign in. This is the kind of a landing page or a dashboard page where you are able to wait in the waiting area. And usually the 8:30 a.m. to 4:30 p.m. is the the time in which you can log in, and patients can come onto this area as well. So usually what happens is, in this area, if there's a patient, when the patient goes into the system, you will get a list of patients waiting in this area, and you need to, as a clinician, you need to join call with them. So they have to be in this area first, and then you as a clinician join them later on. They will appear in the list on this page. So this is the URL or the web link that the patient needs to be given. England.nhs.attendanywhere.com. There is a patient information leaflet as well that you can provide to them, giving them instructions on how to log in. And there is no registration as such for them. They don't need to create a sign-in account or password or anything like that, but they need to make some checks, testing equipment and video call and things like that. They can even log into their laptop, they can log into their phone or iPad, whichever they feel convenient. It's not a problem. So this is how it comes for the patient actually. So they as I've already said, they do not need a login account password. So when they do the registration, they come into the waiting area, and when we are waiting, they join, and both of us can start the consultation. So this is the page for the patient actually. So test call and enter the waiting area. So basically they need to click the button to enter the waiting area for there. So when it is not the usual time, then the page can appear like this, waiting area closed, and it reopens at that particular time. So that's the kind of the screenshots for the. I'll just go back to the presentation again. Probably need to reshare again. Can you see this?
Yes, we can.
Thank you. So, as I said, patient information leaflets, they have about instructions, self-testing the equipment, and then we join the call. And another advantage is, say if the patient wants another person of their carer or parent, they are in a different place, and if they want to log in, more people can also join into the kind of a conference call. That can be done. That should not be a problem as long as the patient consents to it. That's fine. So,
Deepak?
what are the yeah, go on.
Sorry to interrupt. So there is a question from Carla, and it's so to sign up, we just need to go to that website, or does IT need to set us up first?
Uh, there is, I don't think IT needs to get involved. Wherever you are working in your department, if you have your authorized manager who needs to register your name on their website, and you will get an email instruction from one of the admin staff, which I showed you on the screenshot. So, and then you just go and register your trust email ID with a password. That's about it, actually. Without
Deepak,
you,
can
yeah.
I just chip in there? I think when we started, our experience was that you were allocated to a sort of project manager to get things going. So I think that's how you deal with all of the registrations with everybody and things. So it is a case of identifying a project manager to begin with, and that's from within the IT department. But we can get the exact information about that and put that out after somehow. Gurkha, can we circulate that information to people afterwards?
Yes, but I mean, for me at least, I didn't need to contact anybody from the IT team to do the registration.
No, I think if your service is wanting to use it, you need to you have to get a project team to start with.
Yes, yes. Thanks, Lynn. Thank you very much for
Okay.
that. Yes. So for the patient, they just need to enter the basic demographic details, name, date of birth, that kind of, and then they do the self-testing equipment, and we log in, join call in the waiting list, and so the positives are it's possible for MDT working with different clinicians and patients in different locations. So it's not only patient consultations. In fact, if you think about it, if technology works, you can even do CPA meetings or even ward rounds for people not present within the location. So initial, it is kind of if you think about the COVID-19 situation and the social distancing. So this, if technology works, this is quite good actually, and you can set up meetings and consultations quite quickly. There is not many limited setup requirements are needed. There's no need to install any software or anything like that. It's just a website link and you go on. Any device can be used, laptops, phone, or your iPad. And as I said, even like say if there is a patient that needs to be seen in the community, a staff member can log into from their trust site and can see patients at their home, acute consultations or routine consultations, community or inpatients. It meets the clinical and information governance requirements, and as I said, rapid implementation. Not much, software or anything like that to be installed. It's a secure video platform, provides an identical method of patient consultations, almost similar to face-to-face consultations. Obviously, you don't get all those, face-to-face, you're sitting in front of the patient, body language and things. Yeah, I mean, they might be a bit different to that, but still you can see the patient in front of you and over the screen, and they are talking to you, and you can see their movements, or if they're angry, agitated, smiling, all those things you can observe. And it aids home working for staff. It allows to follow guidance for COVID-19, prevent spread of COVID-19 infection, allows consultation irrespective of COVID-19 status of patients. So even if they're inside self-isolation, possibly theoretically you can do that consultation actually, and provision for multiple participants in the consultation. So what are the negatives, if at all any? So there is need for awareness of some basic IT knowledge. So they need to at least be able to go to the website and test the equipment and come onto this platform. Logistical issues. I mean, sometimes if there are patients and carers in different places, they can still join in. Communication aspect could be an issue. But technology-wise, my experience has been that it has been pretty good. Centrally from the AA, I can, as far as I remember, since we started in April, there's been only one or two occasions where the centrally from the AA website there has been a glitch or where we couldn't log in. But otherwise, generally speaking, it's been a pretty good experience, and technology also is quite good. When you log in, actually there are you have a refresh green button and a end red button. So if there is, say, for example, if you get a freezing of the image or video or voice breaking or anything like that, if you just press the green refresh button, it kind of readjusts itself and comes back again and resets itself. So that kind of works around these kind of problems, but it's been minimal actually. It's been really good for patients as well as for us actually. Some negatives. I mean, you can't do physical. I mean, you can't do physical examination yourself. But say, for example, if you want the patient, if they're logged onto their phone, if you want them to show any body part or anything where you know if there is any skin lesion or anything like that, or you ask them to do any movements or physical examination, like say movements of the. So you can do those things as well. But you can't do a physical examination, obviously, because you're not in front of the patient. So that's not possible. So it's not possible for monitoring physical parameters, like for my own experience, I have to do blood pressure, pulse, and uh, uh, physical tests like that. So, but I can't do it but I can ask the patient to monitor the weight at home or tell them to check the blood pressure machine if they have a machine and give me the readings. That can be done. So imaging, I mean, well, imaging again, if they have the uh, uh, results, they can probably show it to you or they can send it by email. Blood test, again, we can't do it. We have patients who kind of funnily ask us, can you do a blood test over the video call? But we can't anyway. So that's the negative bit about it. Patients, sometimes some patients, minority of patients, they prefer face-to-face consultations. They don't prefer the online consultations. That can be a bit of a drawback. Technical glitches, I've already commented on that. It's quite minimal actually. But internet network has to be needed for both ends. I have observed from my own experience that if the internet network is good on both ends, then it works best actually. Sometimes if there is a weak connection, there might be a possibility that there might be a voice break or something like that. And if another thing is if they log into a mobile, make sure you tell them beforehand that if it's a longish consultation that they need to have the mobile charged up fully. They can't be if it is, because it can be used up, because it can use up the charge because it's a video call at the end of the day. And because if, and another, not to say the last is distractions during consultation. If there are other family members or if there is any talk going on between the family members, so you will tend to capture all those things. And another good thing is if they have logged in at home, obviously you're able to capture what is there in their home environment as well. And it is like if you go to a home for a domiciliary visit or a home visit, like you notice the environment in the home, the same way probably you can notice what is going on in the surrounding of their home as well. And sometimes minority of patients, they have even done outdoor consultation, like if they're sitting in the car. So that is also a possibility. So further ideas and improvements, I mean, we have the AA platform at the moment. More video platforms can possibly be explored. Technical issues, if any, probably can be improved. But as I said, as long as the network is good, the experience is usually good. Due to network connectivity issues, say if the internet drops suddenly, then obviously you can't continue the consultation. Better ways of engaging the patients. Obviously, if you do want to do the physical examination things, you can't do it, but it's still a good way because you're still able to continue the patient consultation, and they can still have a continuity of care with you as a clinician. Some patients might not be comfortable with video interface. And another thing which can be possibly done is, so if you have network connectivity issues, or if there is any video freezing or audio call breaking, then you can possibly do a Skype business call along with the AA to ensure that at least they are able to hear you. So if they are logged into the AA through the laptop, and you call them on their mobile through Skype Business, so they can at least hear you properly through the phone, and you're also seeing them over the AA as well, like video call. So that can be done. So I think that's kind of the end of the my presentation actually, and this is the these are some of the references for that. So I'll probably stop there, and because probably Lynn wants to present, unless anybody has got any questions through the chat, which I can answer now at this point.
There have been no questions in the chat, so I wonder whether anybody would like to ask a question at this point. John, you've got a question. Do you want to go?
Hi, yeah. I was just wondering whether you'd had a chance to do any kind of service user evaluation, any kind of surveys or anything to get some kind of general feedback.
Deepak, you sound muted.
Sorry, I didn't realize. So sorry, Jonathan. I said I'm not aware of any such exercise being done in my service. At least I have not done it. Maybe if the team has done it, at least I'm not aware as such. But maybe it has been done in other services. But subjectively, patients do fear, always say, things have been good, and video consultations, they have been able to engage with us, and we could possibly do the consultation. Does that kind of answer your question?
Yeah, it does. Yeah, thanks.
But formally, yeah, objective feedback exercise has not been done. Possibly we need to do it, I think. Yeah.
Just to say that we have done that in the gender identity service.
Yeah,
so we've had
as well.
So we've had service user. Sorry.
No, you go to Grania.
Okay, sorry. Yes, we've done service user feedback, and 40% were very, very pleased, and a further 30% plus were pleased. So very good feedback. And just to preempt the next question, we're also undertaking a QI exercise to get clinician feedback. So anonymous clinician feedback on such issues as backward development, being able to interpret nonverbal communication, whether the clinician felt the objectives were met at the end of the appointment, always with a view to comparison to face-to-face. We're undertaking that at the moment in relation to all the key appointments in our pathway. I think, Deepak, is that do you want to go on mute there? I think there's just some noise there. Yes, we're undertaking that at the moment in relation to all the different appointments in our particular pathway in the gender service. So I'm sure Lynn can add to that as well.
Yeah, I was just going to chip in and say that right from the start, when we were set up on Attend Anywhere, we had 2 questionnaires, so one for staff after every consultation and one for clients to complete after every consultation. So not everybody does complete it, but the feedback is built into the Attend Anywhere setup. And then I think Ailish had a hand up to come in, so the data is we're still sort of working out, I think, the access to the data and the reporting of it to get it in a really nice, usable form. But all the background stuff is there and ready to go. So we've had a couple of reports from it early on. It's just a case of sort of refining that so it's in a nice, easy to use way. We have done a few sort of straw polls amongst the staff just to get ongoing impressions of how it's working. So I'll perhaps talk about that in a minute with when I get onto the other sort of stuff about how we found it in our service, if that's helpful.
Grania, your hand is still up. Did you want to come in again?
That's an old hand.
Okay, thank you. Carla put a question on the chat. Has anyone worked with the older adults using this format?
Yeah, perhaps that's a lead in for me to talk about my client group actually, because, or our client group, because yeah, shall I just go for it, guys? So my name's Lynn Bursko. I'm one of the operational team managers for long-term neurological conditions here in Sheffield. And I'm a speech and language therapist by profession. So the nature of our work, I mean, as Deepak said, when COVID came along, a lot of our work would have been seeing people in their own homes, some proportion in outpatient settings, but also including care homes. And that was across a whole age range from sort of 16 to 100. And by definition, people with long-term neurological conditions, we have a separate brain injury service, but in the neurological enablement service, that would be people largely with multiple sclerosis, a lot of people with Parkinson's, motor neuron disease, clients with Huntington's, so right the way across the kind of age spectrum. So obviously there's sort of consideration in terms of using technology with older clients, but we all know about Silver Surfers. There's plenty of old people that can make very good use of technology. So it's not actually age that necessarily kind of can restrict and make things difficult for people. But obviously we're also dealing with people with a range of disabilities. So it may be that directly their communication is affected, but it also could be that we're working with people with cognitive difficulties, visual impairments and hearing impairments. So, you know, and clients that are quite isolated, who may or may not have support from others around them to help with the technology. So that's sort of our client group. The roles then can be a bit challenging in terms of, following on from what Deepak was saying, we do face-to-face interviews with clients, particularly at the start of our intervention, and sort of an initial interview gathering session. But from there on in, it could be a range of therapists that work with the client. So it may be physiotherapists, occupational therapists, speech and language therapists and psychologists. And a lot of their work would traditionally be quite hands-on, physically, you know, in the presence of the clients. For the occupational therapists, they're looking at the home environment, looking at equipment, safety and risk issues for people with disabilities in their own home. So, you know, there's quite a lot of challenges there that we've, you know, sort of worked to overcome. So in terms of the sort of advantages, disadvantages, pros and cons, obviously all those things that Deepak said about clients who, because of COVID, are maybe unable to see us, or you know, vulnerable and unwilling to see us, and equally us not wanting to put ourselves in a home situation. But it does limit the amount that we can actually achieve via video consultation. You know, there are some things that we just cannot and are unable to do via video consultation. However, the stuff that we can do, we have used Attend Anywhere for quite successfully, and clients are very grateful that you know, it can be an alternative to them you know, having to be seen in clinic. So it sort of makes them feel more confident about you know, the fact that they don't have to come into a clinic or invite someone into the home. And also we've measured up you know, and made very clear to them maybe there's a blended approach, so we can do some essential stuff that needs to be done in the home environment or a clinic setting, and then some of it that can carry on via video. And that comes across in the feedback. You know, people are very positive about having that as an option. I think also people have, since sort of April, May time, people have become more au fait with technology and doing things via video links. So most of the time when we offer the alternatives that we can provide, a lot of people will say, oh yes, I've used FaceTime with my grandchildren, or I'm used to using WhatsApp video. So people have become more and more familiar with video as a means of communication as time has gone on. I don't think, and perhaps we can go back to Gonya in terms of the sort of technology glitches and things, although at the beginning when we first launched, the Attend Anywhere platform did have a few glitches itself. That was soon ironed out, but then following on from that, we do find that some clients maybe just haven't got the Wi-Fi to support the platform, or they haven't got the the actual hardware that can make the give you a good image, give you good continuity. So we do have some ongoing issues, and that can be very frustrating for clients. And so sometimes clinicians and clients have given up on the video consultation and resorted to phone. I think the other thing that we've had in more recent feedback is that some people actually are quite happy to try and do things over the phone. They might feel quite self-conscious about using video as a platform, and are actually saying that they're quite happy to use the telephone instead. So we feel as if it's a tool that we can offer and we can give people that choice, but it's certainly not for all of our clients. On the other hand, as Deepak said, one of the good things about having very portable video use on something like a mobile phone is you can say to the client, well, can you take your mobile phone into your bathroom and show me the setup? So there's some creative ways that we've used it to actually enable us to see inside people's home environment, or maybe see some of the movements or the difficulties that they're having via this means. So yeah, a kind of a mixed bag of feedback, but hopefully that addresses, Carly, your question about using it with older clients and people with a range of difficulties, really. Does anyone want to ask any questions there?
No questions have come in through the chat, Lynn, at this stage, but
she's just popped something on the chat saying that we've had 356 responses from staff. So 350 staff have made comments and 133 service users. So yeah, it's we've got quite a bank of data to go back there and to sift through. Shall I hand over to Grania then?
Hi. Right, thank you, Lynn. Thank you, Deepak. So yes, I'm Grania Coakley. I'm the clinical lead in the Gender Identity Service. We were involved in the pilot as well in April, and our operational manager, Katie Rowe, did a huge amount of work, as did the manager, Donna Prescott in SANS. And they supported us to get it up and running as a pilot really quite quickly. And I'm not very good at IT stuff, and I find it very easy to use. We had a mixed response initially from the various members of the MDT about moving to a video platform. So some people were very enthusiastic. Some clinicians were a little bit anxious about the validity of it, I guess, relative to face-to-face. And as I touched on earlier, concerns around developing a rapport, being able to interpret non-verbal communication, being able to support somebody if they became distressed and that sort of thing. We have a high percentage of people coming to our clinic who have neurodiverse difficulties and communication difficulties as well. We put into play really quite a lot of governance around it and tried to preempt and measure the concerns. And really one by one, the concerns we felt actually weren't actualized, and there were things we could put in place and improve our paperwork and documentation that were sent out to service users prior to the appointments. We also started getting anonymous clinician feedback on the various concerns they may have had, and to rate the consultation on the video platform against what they imagine would have happened had it been face-to-face. So we haven't had that returned yet, but the sort of anecdotal evidence within the clinic is that clinicians find it really very helpful. The big caveat for our clinic is, though, that we like to have seen the person face to face initially. The interventions we offer in the gender identity service are, you know, fairly significant medical interventions that have irreversible consequences. And we make recommendations for surgical interventions that are absolutely irreversible. So there was some concern about seeing somebody potentially through a pathway like that without ever having met them face to face. So we've stuck with that actually, and that at least one of our assessment appointments will be by a face-to-face appointment. So during the pandemic, we had lots of people that we could see using the video platform because we had seen so many of them in face-to-face appointments earlier in the year. But we kind of ran through all of those appointments really by the end of August. So we started seeing people face-to-face again, but again, only those diagnostic appointments, and where appropriate, do the intervention and follow-up appointments over AA. So the speakers earlier have already covered the practical problems. So IT issues, connectivity, privacy. I've been surprised actually. Most people are able to use AA, and most people have the requisite technology. I think we've quite a young population of service users, but actually our older service users as well were able to access laptops and cameras for, to participate. So I mentioned the governance of the process. We thought about each of our appointments individually and the objectives that needed to be met within each appointment, and we considered again the validity of doing that on a video platform versus face-to-face, and whether it was appropriate to continue with that particular appointment. And actually, one by one, each of the appointments, all of the multidisciplinary team felt actually it was okay to do it over AA if the person was also consenting and comfortable with that. We ensured regular feedback within the team about it to allay any fears. I think that's very important if you're introducing it to your service. Just trying to think, I'd want to repeat what's already been said. We're in contact with other clinics as well, other gender identity services. They've all had similar experiences to us. We're slightly different to the two services that have been spoken about previously, in that our service specifications, new service specifications from NHS England, part of the tender requirement was that we were able to provide remote consultation. So the fact that AA was rolled out so quickly because of the pandemic has been really great for us, because we don't have to go back to the drawing board and come up with remote consultation policies and procedures from scratch. So it's been really helpful. The feedback from my colleagues in the other clinics would be, and we would concur, that we can probably do about 70% of our appointments using AA going forward, which is really great because we're a national service, and to reduce that amount of travelling for that number of people has been really positive. We have had some unusual occurrences with it. So we've had people thinking it was okay to have their appointment whilst riding a bicycle. So that led to obviously safety concerns. We've had people who perhaps didn't wear as much clothing as they would had they been coming in for a face-to-face. So again, we've updated our documentation about what's appropriate and perhaps what isn't helpful as we've gone along. So sort of reinforcing the need to keep talking with the team to get feedback to improve the process. I think that's it really. So I hope that's been helpful, and happy to take any questions.
Any questions from anybody at this point? I did see earlier, I think somebody had put their hand up, but I'd actually missed it, and it may have gone. Was it? I'm just thinking. Was somebody earlier who had their hand up, but I didn't actually see it. Who would like to ask their question now? Well, we've missed that one, or it's been answered. There's also, maybe it's worth at this point to just share as well. There's been a bit of chat with regards to, you know, the support that is available. So Lynn, you talked about the project team that supports with regards to background paperwork and advice, information, instructions to send to clients with appointment letters. And also the work that has been done, like a SOP that was written for the services in long-term neurological conditions, SANS and gender, which could be drawn on by other services.
Yeah, well, with the project team, I'd have to check the exact name of the person who's leading on that now. I can't bring it to mind. It's Karen and somebody, but she allocated us a project lead, and then we had a couple of meetings just really guiding us through everything that had to be set up, and we identified, you know, somebody in the admin team who was going to, you know, who really led on it, took a major role in it. But then, you know, there was a number of us that met to make sure that, you know, we met all of the sort of targets along the way. And yeah, it was really helpful to have that member there. You know, someone who knew all the places to go to for all the sort of questions and queries that you know, that we raised, and to go back to the Attend Anywhere information, but also, you know, how to kind of modify things and make things useful and specific to our service. So that was great to have that guidance all the way through. And you know, when they left after a month, we thought, oh, the panic, it's not going to work out. But in actual fact, it's gone very smoothly since then, and we haven't really had any issues. So it was worth that investment from and the support from the project team to get you started at the beginning.
Thank you, Lynn. Anne, you have your hand raised. Would you like to?
Yes, I would. Firstly, I'd just say hello. I'm Andre. I'm a new non-executive director at the Trust, and I haven't actually started yet. I start in November, so this is my first sort of interaction really with you. So, and also I managed to miss the first few minutes, so if it's already been answered, I do apologise. But I was just interested in terms of, Deepak, you said at the beginning that all the sort of clinical governance and all that sort of stuff was all sorted with this system, and I just wondered, do you video the consultations? Does that stay as part of the, right? Because my next question, if you'd said yes, would have been, can individuals actually have copies of this so that they can, you know, have another look at the consultation afterwards, if that was something they wanted to do? You're on mute again, Deepak.
Sorry, I think it was already there in one of my slides. Actually, the patients have a kind of they have to tick the box saying that they won't be able to record this consultation.
Okay.
So it's part of their kind of agreement that they should not be recording the consultation. So I think they will usually get the assessment letter as usual. They get it to the GP. We do, and they get a copy if they want, but they can't record the consultation.
Right. Okay.
Does that answer your question?
It does, as a fact. It was just that bit about, you know, going forward, whether actually it might be something that this evolves into, so that people who might, you know, we all have a conversation with somebody and go away sometimes with a different understanding of what was said in the room, and the ability to actually go over it again might be something that might be useful for some people going forward. But I understand where we are at the moment. Thank you.
You could probably offer a follow-up or an additional session to discuss about, you know, if they have any questions or if they want to discuss what the assessment has gone through.
Yeah.
Usually we do that in our service anyway. So I don't know whether Gronny and Lynn had any more thoughts.
I just agree with you, Anne, that it would, you know, for some clients it is really useful to be able to go back and to listen to that again, because you know, with a lot of our clients, we very much encourage them to have someone else with them at the consultation.
Yeah.
Attend Anywhere is great from that, because you know, for carers that are distant, they can join in the conversation. So that is no problem. You can, you know, it's easy to have other people in on the consultation. I think it works up to about 5 people you can have joining in that same appointment. But nevertheless, yeah, you can't always remember everything that's said, and you could have disputes between you as to what was said, and it could be really useful to go back and listen to that. But whether it's to do with the capacity of the system, you know, that is limited in terms of recording it, but a suggestion for an improvement to attend anywhere, I think.
Yeah. Thank you.
And you've still got your hand up. Do you? No, it's an old hand up. Okay, thank you. Grania, anything else from you to add there, or any thoughts?
I mean, just in terms of...
You're on mute. Grania, you're on mute.
Yes, just to say also that was something we considered in our team, and we ask people not to record. However, in a face-to-face consultation, some people like to record the audio for those reasons, that they sometimes, it's hard to take in all of the information. So if somebody requested that whilst having their consultation over Attend Anywhere, whilst you mightn't be able to do it through the system, they could still, I'm sure, just record as they would if they were in a face-to-face meeting. And also we would still document and send a letter to the person and the person's GP as we would a face-to-face consultation. So I think we would aim to do and provide everything that we would do or provide if it, you know, if it was a face-to-face, and that includes recording if people wish, as long as they share that with the clinician at the outset, which I think is appropriate. Yeah.
Thank you. Jonathan?
Hi again. Yeah, you guys might have already mentioned this. I can't remember. I was just wondering whether there's the kind of chat function, you know, like we've got here on Teams and on some other things. Is there that chat function on Attend Anywhere, or is it just the video?
There's a chat function. So I've used that if I can't hear the person, literally to say I can't hear you. But you, I mean, with our appointments, it wouldn't be appropriate to do the entire thing through a chat function. But it can be helpful if there's glitches with the audio. And I think, as Deepak said, if the AA audio kind of goes a bit awry, you can simultaneously phone as well, and so it can be useful to use the chat function to communicate with each other, you and the service user, whilst you're trying to negotiate that.
That's useful to know, thanks. And just with the chat function, are you able to attach things on there as well, like we can on Teams? You know, to attach a, I don't know, a Word document or a PDF or something. You know, if you wanted to share a leaflet with somebody,
yeah,
you're able to attach that onto chat for them to open up at home, or is that not possible?
I don't think so. And we do capacity and informed consent appointments using Attend Anywhere, and we post the leaflets, the medication leaflets and the consent form prior to the appointment, and they sign the consent forms during the appointment. So I'm assuming we're doing that because we can't do that during the consultation, but Deepak or Lynn might know better.
Well, if they're able to log into the AA, I mean, you can, through the chat function, you can send the links, whatever, but you can't send attachments, I suppose. But the problem was, the problem sometimes we get is where at the time of appointment, they're not able to log in. Usually what I do is I wait for 5-10 minutes and then I ring them, you know, to ask them, oh, have they got any problems logging in? Have they got onto the website? And then usually what happens is they have not got that information, or they're trying the link and there's some problem. So again, because they're not able to come onto the platform, that's the main problem sometimes I have. So basically just ringing them again and going with them through the proper steps of how to log in or how to go on the website. And then once they log in, you can send anything through the chat, any information or link or typing, but you can't send attachments. I have not. I don't think so. I can't remember sending any attachments or them able to see send any attachments.
Lynn, did you have to add something to this?
Yeah, I was just going to add in terms of attendance. And Deepak, you said you phone people if they've not logged on. We're finding that for some clients, and I don't know how much of an issue it is, I need to sort of look back at the data, is that somehow an appointment via Attend Anywhere isn't given quite as much credence as a face-to-face or an outpatient appointment. So people tend to forget they've got the appointment. So sometimes we are using SMS text reminders, which we would normally do for our appointments anyway. But I have had it reported that people tend not to, tend not to give it quite as much weight as if it was a face-to-face appointment or an outpatient appointment. But hopefully with the text reminders, that will be less of an issue.
Thank you. Amanda, you've got your hand up.
Hi, sorry, I had to attend late to this meeting because I've been very busy with referrals and stuff. But so I've missed quite a lot of it. But is there a function where we can trial this? You know, because we're not using it yet as a team. Is there like a dummy site we can trial it between each other?
Yes. There's, yeah.
Yes.
Via Gurkha and via Gurkha's advice, we can certainly distribute that, or I don't know if some information will go out via comms, but yes, there are things that you can view. There's lots of videos that AA produce so that you can see it in action before you commit.
Okay, Brill, thank you.
You can also do role play with colleagues as well, which we did, with a colleague being the service user and so on.
Yeah, that's what I was thinking. You know,
Yeah.
so you get a good angle of what it's all about and how it's useful and stuff.
Yeah, that's what.
And if I remember it right, I think the Attend Anywhere website has got some demo videos as well, which you can go and view as well. Yeah.
Where do you view them? Sorry.
It's the Attend Anywhere website.
Okay, yeah. Okay, Brill, thank you.
Okay, any other questions, comments? Or if there are no questions, we could always kind of wrap it up at this point. Shall we do that? So, well, thank you very much, Lynn, Grania and Deepak. This has kind of provided a really interesting conversation and learning together. And thank you everyone for joining for the session, and hope to see you also for other sessions in the week. I know there's quite a few things coming through now, but that's, I think, all thank yous. So, well, have a lovely rest of the day and hopefully see you later in the week. Bye-bye.
Thanks, bye.